Welcome for everyone. Today we will talk about Behcet disease. I will call it the deceiver because most of us know it as an orogenital ulcers and only uveitis. However, the ICBD 2014, the modified criteria, include ocular manifestations, oral abscess, genital abscess, skin lesions, CNS, and vascular manifestations. The pathology test, usually we don't do it. It is a neutrophilic reaction and non-specific for Behcet, and there is no guidelines about it. So, Behcet syndrome is a syndrome of many manifestations, and there is a phenotypes for it. Do you know about the mucocutaneous and articular manifestations? It is one of the phenotypes. Usually include orogenital ulcers and enthesitis, low back pain, or spire-like manifestations. Other phenotypes is the extraparenchymal neurological and peripheral vascular manifestations. The vascular involvement to the central and peripheral CNS can cause manifestations. The cerebral venous sinus thrombosis and arterial thrombosis is common. The third manifestations or phenotyping is the parenchymal CNS with ocular manifestations. Usually the posterior uveitis associated with parenchymal tissue. Here is a photo for Behcet syndrome, which includes many manifestations: central nervous system, psychological symptoms and depression, the eye, the cardiovascular system, the oral and genital ulcer, the GIT. It may cause perforation. It is more common in Japanese patients. The chronic fatigue is very common with Behcet. The joint involvement, the skin, erythema or papules or folliculitis is very common, and the vascular manifestations like DVT or inferior vena cava or any aortic aneurysm. The vascular Behcet is one of the phenotypes. We can exclude it from other vascular diseases. It can present with venous thrombosis at any site, commonly at the cerebral venous sinus thrombosis with intracranial hypertension manifestation and headache, which is a common manifestation in the chronic diseases and Behcet syndrome. Arterial aneurysm, especially in the aorta and its branch. Pulmonary artery is also can be affected with the coronaries. It's important to know if there is aneurysm or not to avoid using anticoagulant. Arterial pseudoaneurysm and arterial obstruction is also one of the manifestations which is common with vascular Behcet. Neurobehcet, it can be parenchymal lesion in the brain and spinal cord tissue due to inflammation and vasculitis, or non-parenchymal due to stroke, transverse myelitis, or increased intracranial pressure due to vascular causes. Brainstem can be affected as ocular manifestation and its symptoms, or meningomyelitis or confusional syndromes. The eye, it is the key of the disease. Do you know it is the most cause of morbidity? Blindness occurs within 5 to 8 years of diagnosis. It may be the first manifestation of the disease. It is in 90 to 70% of the patients. It is very common, and usually patients lose their eye, both or one. Can be anterior uveitis or posterior uveitis. It is important to know what is the type of lesion. For each type there is a specific treatment. Investigations, usually we do a routine laboratory, but it is not specific with Behcet syndrome. The imaging for neuro or vascular causes, or heart or Doppler vein or arteries manifestations. Eye is important for regular assessments. You should do slit lamp fundus examination, CT angio for retinal artery and retinal vein, which may have a thrombosis and cause blindness. You should request for the ophthalmologist to exclude the granulomatous uveitis. Behcet is non-granulomatous uveitis. Check for any headache or eye pain or any complaint. Follow up the ophthalmology and the rheumatology clinic. You should visit the doctor every 6 to 12 months. You should have a proper clinical assessment for all systems in the patient. The proper treatment tailoring for each symptom and each activity and the degree of the symptom. The follow-up, which usually used with Behcet patients for the activity, is the Behcet, and for the disease damage is the body score. This is a picture for Behcet. This is a picture of body score. They are not accurate or specific in the lesion, but it is the last updated activity scores. This is an MRI for brainstem in Behcet patient with the mid-bones affection with whitish area, as you see here, and here. This is the eye investigation that we can see the fundus, the hemorrhage, the thrombosis, and the retinal edema. This is very important because it is very common cause in blindness in the Behcet patient. So the take-home message: early suspect Behcet disease, even if you are not a specialist. Early treat Behcet. Early consult a specialist for Behcet.